students, I am Dr. Hemant and I am going to be telling you today about the knee ligament injury and the meniscus injury. So if you see our knee joint is made up of one bone on the top, one bone at the bottom, and if you see there is one ligament on the side, so this is another one, then one ligament in front of the knee called ACL and one ligament is behind called PCL, and in between the two knees we have shock absorbers like this. So this shock absorber is a structure which is like a rubber. Okay, it helps in preventing the friction, rubbing of the two bones of the knee joint. Most of the people who are young, sports people who play cricket, football, they can have injury to either the ligament, which is the present in the front of the knee, most commonly, less commonly ligament behind the knee. When such injuries occur, people will say they heard a pop, there was a sound and the knee suddenly got swollen. Now these injuries do require some form of a treatment, especially if you want to continue the sports. Some people who are elderly, older age group, no surgery is required. But people who are young, who want to play sports, who want to have an active life, they do require a ligament reconstruction. So it's a fairly simple, straightforward surgery done with an arthroscope where no big cuts are made. A small cut from where an instrument can go inside. We take your own ligament and we put it at the place where your original ligament is there. And after the surgery, we allow the patients to walk, and it takes 6 to 9 months before they can start football. It takes around 4 months when they start running and around 4 weeks when they can start driving. Now, just a small word about the meniscus. So previously, when meniscus were injured, we as doctors used to cut it and trim it. Now, of course, this is a shock absorber. It's not a good thing to trim it. Now we have repair techniques and technology. We can repair the meniscus. So if you repair your own meniscus, you continue to have that shock absorbing effect and it prevents you from further arthritis. Now repair can be expensive because it depends upon how many stitches we have to use, and there are different techniques. One thing I would want you to know, repair can be done either without the ligament injury if you have only meniscus tear, or it is done along with the ACL, because sometimes the ligament injury is associated with the meniscus tear. And when meniscus is repaired, we will not allow you to put weight on that knee for 6 weeks duration because we have to protect that repair. These surgeries are very good, very successful, and can actually get our patients back to sports and prevent them from arthritis. Thank you.